Hello, coming to you from the World Economic Forum. I'm joined by Dr. Shamsheer Vayalil, founder and chairman of Burjeel Holdings. Thanks for chatting with me today. What's on your agenda at Davos this year? What have you been working on?
So this has been one of the very interesting Davos, especially with the change in leadership in US, a lot of change agendas. So we've been busy with a lot of activities. We've been spearheading the climate and health initiatives here in the World Economic Forum. We are also having a lot of discussions on AI into healthcare, and that's what has been a busy schedule for us.
So this change in US leadership, is that going to change the way you operate your healthcare centers?
So we always work to the situation, right? So we are from Abu Dhabi, and we have operations across GCC and Africa. So we are very agile in the sense that we need a lot more healthcare for the region, and our leadership expands healthcare into most of the African countries. You've seen Earthside getting formed. So we feel that there's a lot more reactive measures that is now going to happen. And I think any change is welcome. We always see that there's opportunities that come with change.
And tell us, how do you see the evolution of healthcare in the UAE where you're based, but also in the broader GCC, Africa, and internationally?
So if you take UAE, people used to travel outside when it comes to healthcare. That has reduced drastically. And I think it's going to the other extreme of people flying in to get treated in UAE. So thanks to the government initiatives, compulsory insurance, the concept of livability, employee well-being, UAE is at the forefront. So we have Cleveland Clinic, we are there, we have our partners, which does a lot of work into research and education. So the delivery model is changing. It's not just a pure, a commodity play. We talk about research, we talk about education. So there's a big change happening right now.
And I would be remiss if I didn't ask you about your forecast for Q1 or your reaction to your numbers for 2024.
24 has been a great year for us, and I think we are at par with the forecast. I think we tend to grow. We tend to grow on a double-digit pattern. And it's all about how much more we can take at this point of time, because we see a lot of opportunities. We see that historically people used to travel to US at that spectrum, which we are focusing on to bringing them to the UAE for treatment. So it all depends on how fast we can move. Speed is going to be the name of the game. We could decide how much we want to grow and then deliver the growth.
So projections for Q1 then?
I don't want to just go ahead because already it has been given to the analysts. So I don't want to step on that toes. And definitely growth is on the cards. We tend to maintain the growth that we have promised. And I think we don't want to just jump directly into those numbers, but I think we are sure to grow.
And tell us about any new business that you're planning on launching in the year ahead, any new acquisitions?
So for 25, we are bringing more AI to make sure that the repetitive component of our offering is moved onto agentic AI. So that is something very interesting for us to make sure the quality of the service is going to improve. So we just don't want to just increase the number of patients we serve. We want to serve them well. We want to make sure that they are given that extra care that they deserve. So again, 24 was very busy for us. We went into Saudi, we did our physio expansions. We are continuing to do that across, and I think our capacity utilization also is getting more refined. We are invested more into the subspecialties like oncology. We are bringing clinical trials into the country. So it's about the quality of the yield rather than the quantity of growth. So we are also trying to find a balance.
Well, thank you so much for chatting with me today.
Thank you. Thank you so much. Thank you.